Have you ever wondered why prostate cancer is often referred to as a silent killer? Today, we're going to explore just that. Prostate cancer is a critical health issue that demands our attention. It's a global phenomenon affecting millions of men worldwide every year, and the numbers are only rising. Yet, what makes this disease even more menacing is its stealthy nature. In its early stages, prostate cancer can often progress without any noticeable symptoms, silently spreading its roots. This quiet progression is what earns it the chilling nickname silent killer. The absence of early warning signs makes it a formidable adversary, one that we can only combat through knowledge and vigilance. Prostate cancer might be silent, but we don't have to be. Our best weapon is understanding this disease, its risks, and its impacts. So, let's delve deeper and uncover the truth about this silent killer. Now, you might be wondering, what symptoms should I look out for? Prostate cancer tends to develop gradually and subtly. It often starts with minor changes in how you urinate. You might notice more frequent urges to urinate, especially at night. Or perhaps you struggle to start urinating, or once you've started, you find it tough to entirely stop. This inconsistency in your urinary pattern may be accompanied by a weak or interrupted urine flow. Another symptom that could potentially point towards prostate cancer is discomfort in the pelvic area. You might feel a persistent dull ache or sharp pain in your lower back, hips, or thighs. It's important to remember that these symptoms are usually caused by less serious issues, like prostate enlargement or an infection, but they could also be early signs of prostate cancer. Then there are the more severe symptoms. These include blood in your urine or semen. Now, this might sound scary, but it's important to note that while these symptoms are less common, they are more likely to indicate the presence of prostate cancer or other serious conditions. You might also experience erectile dysfunction, another potential yet less common symptom of prostate cancer. This is characterized by difficulty in achieving or maintaining an erection. Let's not forget symptoms related to advanced prostate cancer. When the cancer has spread beyond the prostate, symptoms can include unexplained weight loss, fatigue, or bone pain. However, keep in mind many men with prostate cancer often have no symptoms at all, especially in the early stages. And that's why regular checkups are so important. These symptoms do not confirm cancer, but they do warrant a trip to the doctor. If you're experiencing any of these symptoms, don't panic, but do seek medical attention. It could be something minor, or it could be a crucial early warning sign. Remember, early detection can be a lifesaver. So, don't ignore these signs. Your health is your most valuable asset, and it's worth the time and effort to take care of it. Because when it comes to your health, you're the first line of defense. So what happens next if you experience these symptoms? Well, if you do, your doctor might recommend several diagnostic procedures to confirm if it's indeed prostate cancer. The first method is the PSA blood test. PSA stands for prostate-specific antigen, a protein produced by the prostate gland. Elevated levels of PSA can suggest the presence of cancer. The second procedure is a digital rectal exam, or DRE for short. In this procedure, your doctor will physically examine your prostate gland to check for any abnormalities. It might sound a bit uncomfortable, but it's a vital step in the diagnosis process. Lastly, if these tests indicate the possibility of cancer, a biopsy might be required. This involves taking a small sample of prostate tissue for lab analysis to confirm the presence and extent of cancer. Getting a diagnosis can be daunting, but it's the first step towards effective treatment. Remember, knowledge is power, and being proactive can make all the difference in your journey towards health. Now, let's talk about the light at the end of the tunnel. Treatment options. When it comes to treating prostate cancer, there are several paths one can take, each with its own set of considerations. It's important to remember, however, that the choice of treatment depends on a number of factors such as age, overall health, and the stage of the cancer. Firstly, there's surgery, more specifically, a procedure known as radical prostatectomy. This involves the removal of the entire prostate gland and some surrounding tissue, a procedure that can be highly effective but also comes with its own risks and potential side effects like urinary incontinence and sexual dysfunction. Another common treatment is radiation therapy. This method uses high-energy rays to kill cancer cells. It can be delivered externally through a process known as external beam radiation or internally through a process called brachytherapy, which involves implanting radioactive seeds directly into the prostate. Next, we have hormone therapy. Since prostate cancer cells need testosterone to grow, hormone therapy aims to reduce the body's production of this hormone or to block its effect. This can slow the growth of the cancer or even shrink it. Chemotherapy, on the other hand, uses drugs to kill rapidly growing cells, including cancer cells. It can be used if the cancer has spread outside the prostate gland and hormone therapy isn't working. Last but not least, there's immunotherapy. This is a relatively new form of treatment that uses the body's own immune system to fight cancer. It's usually reserved for advanced prostate cancer that hasn't responded to hormone therapy. It's important to remember that each of these treatments comes with its own set of potential side effects and risks. The decision should always be made in consultation with your doctor, taking into account your personal circumstances and the specific nature of your cancer. With the right treatment, many men with prostate cancer lead full and active lives. Let's quickly recap what we've learned about prostate cancer. This silent killer could be lurking undetected, manifesting through subtle symptoms such as frequent urination, discomfort in the pelvic area, or blood in the urine or semen. It's vital to recognize these signs early, as they might be the only indicators before the disease progresses further. Next, we delved into diagnostic procedures. Remember, a simple blood test checking your prostate-specific antigen levels, a digital rectal exam, or a biopsy could be the key to catching this disease in its tracks. Then, we discussed the various treatment options. From surgery to radiation therapy, hormone therapy, and even chemotherapy, the choice of treatment depends on multiple factors, including the stage of the disease and your overall health. The importance of early detection and regular checkups cannot be overstated. It's not just about survival, but also about maintaining a good quality of life. Remember, knowledge is power. Stay informed and stay healthy.